everyone. Good evening. Thank you for joining Guesting Bariatric's first Instagram live session. Looking forward to seeing our subsequent versions and editions of the program. So my name is Okoyemi and I'm a bariatric dietitian with Guesting Bariatrics here in Abuja. With me today I have Dr. Timi Adenuga. He's a bariatric surgeon and we'll be shedding light on the topic of discuss for today, which is weight loss surgery in Nigeria. Is it safe? Thank you for coming, sir.
Thank you.
So we just get started. The first question we have here is, kindly provide an overview of the different types of weight loss surgeries commonly performed in Nigeria.
So broadly speaking, the two commonest weight loss surgeries available here in the country, we're talking about the gastric bypass and then the gastric sleeve. They are readily available, Lagos, Abuja, Kano, you can get it readily available, yes.
Okay. So, you mentioned gastric bypass and gastric sleeve. So, I know here at Guesting Bariatrics, the gastric sleeve is what we actually do. So, would you like to shed more light on gastric sleeve? Why gastric sleeve in Nigeria? Why not bypass? Or why gastric sleeve in gastric, not gastric bypass?
So, in the world, the gastric sleeve is the commonest surgery for weight loss. Again, many people misconstrue gastric bypass for gastric sleeve. Most, up to 50-60% of all the weight loss surgeries in the world are gastric sleeve. And the reason is not far-fetched. It is one of the safest of all the options for weight loss surgery. The gastric sleeve is one of the safest. It's durable, it's fast. And the most important thing is that the risk of complications with these surgeries are very, 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 very low. So many people opt to have the gastric sleeve, surgeons and patients alike, yes.
All right, thank you, sir. So the next question, can you explain the purpose and potential benefits of weight loss surgery?
Okay, so weight loss surgery, of all the options for surgery, we've got the balloon, we have the injections. Weight loss surgery ranks above all of them in terms of cost effectiveness, in terms of durability, in terms of the ability of the procedure to cause weight loss. And the benefits are marked, apart from weight loss, which is a good thing. Some comorbidities like hypertension, diabetes, sleep apnea, fatty liver disease, knee pain, back pain, all those things are readily solved after weight loss surgery. So it's an important tool to tackle weight loss and obesity.
Okay. So when we're talking of weight loss, when we're talking of obesity and overweight, is there anybody with any BMI, anybody mass index that actually qualify for weight loss surgery? Or we have a particular BMI that we look out for before we can say, okay, this person actually qualifies for weight loss surgery?
So generally speaking, okay, for those of you who don't know, and then you can do this, is you have to calculate your BMI. It's the weight over your height. You can go to our website and then use the calculator there. So the normal BMI is between 18.5 and 24.9, and if you are between 25 and 30, you're classified as overweight. If you're between 30 and 40, you're obese. After 40, you're morbidly obese. So for anybody above 40 BMI, we advise them to go for weight loss surgery, because the amount of weight you have to lose is quite a bit, and weight loss surgery is what can give you that amount and can do it over a period of years and durability. So I get many patients who come to me to the clinic, they've got a BMI of 50, for example, and they tell me they want to have injections or they want to have the balloon. I always tell them that yes, you can have it out of this, but it's not going to get you to your ideal weight. And generally speaking, if you have a BMI of 40 and above, the advice I would give you is plan or think about weight loss surgery. If you have a BMI of 35 and you have one of these obesity-related conditions such as hypertension, type 2 diabetes, high cholesterol, those are patients who will benefit also from weight loss surgery, because as I said earlier, weight loss surgery leads to resolution of many of these comorbidities, aside causing weight loss. So 35 and above with comorbidities, or 40 with or without comorbidities.
All right, thank you so much for that. So to our next question, can you address some common safety concerns that are related to weight loss surgery in Nigeria?
Yes. So, few things to talk about before I go into that is that even in developed world, weight loss surgery is not is taken with some some fear to be exact. Nigeria in particular is worse because there's a stigma associated with weight loss surgery. Everyone believes that why should you do weight loss surgery? Why can't you diet? Why can't you go to the gym? But science has shown us that obesity and overweight is way beyond whatever you do. Sometimes you need help. That being said, there are like 3 major reasons I've noticed why people are scared of weight loss surgery. One is anesthesia. So a client walks up into my office and tells me, doctor, I'm weight loss surgery, I'm game, but I don't want to sleep. And then it becomes a worry because you can't do weight loss surgery without anesthesia. So it's general anesthesia, and that means that you have to sleep. So people are scared of anesthesia. They want to do it awake. You can do a lipo. There is awake lipo. I'm sure that there is awake BBL, but there is certainly no way you can do weight loss surgery awake because all the job is up here, and you need to be asleep for that. So that is one major reason why people are scared. And what I tell people is that if you're sure of where you're doing your operation, if you are in a good center, good hospitals, the risk of anesthesia, even though it's there, it's very minimal. So that is one. The next reason why people are really scared of having their surgery done in Nigeria is because of the surgical expertise. So everyone believes that weight loss surgery is a new field, in quotes, in Africa, and then it should be done by Nigerians or local surgeons, and that is very far from the truth. To be honest, weight loss surgery has been in this country for 11-12 years now. Maybe now it's getting a bit of popularity because we're getting some influencers coming on board, but weight loss surgery has always been around, and there's no game saying that the quality of surgical care you get in Nigeria, especially with trained people, is at least equal to what you get anywhere in the world, be it Turkey or Dubai or Egypt or in the UK. So that needs to be said. You can get good weight loss surgery with similar outcomes, with similar safety, done in Nigeria by local surgeons. Then the third reason why people are scared of weight loss surgery is the aftercare and follow-up. So many people believe that, okay, if I do weight loss surgery, I might not be able to recover for the next 1 month, I'll be on bed, I have to shelve off my plans. That is far from correct. Most people who have weight loss surgery are discharged within 24 hours post-surgery, maximum maybe 48 hours. And return to work, usually, I tell people this, that I've had a patient who went back to work within 3 or 4 days after that procedure, and nobody knew what was happening. So that is a fear that has no base, to be honest. And again, in terms of follow-up, you're better off having your surgery in your country, where you have your people, you've got your friends, you've got your family, you have people that speak your language. I take a jab at people who go to Turkey. So they go to Turkey and they come and see me, and then they have to talk to the translator has to talk to the doctor, and then the doctor has to talk to the translator, and then revert to them. So one example, and this might sound funny, was someone was complaining about heartburn or something. I think she told the translator told the doctor, and by the time the whole information came back, they were treating something else. So it was really funny. Aside that, you're talking about meal plans. You go to Europe, for example, they give you all sorts of funny looking food. We've had people reach out to us to get meal plans before their sleep surgery. So why not just do all that and do it here? So the aftercare, the follow-up care you get if you have your surgery done in Nigeria is far better. I can say that for a fact, because you have local people, you have a hospital you can go to if you run into problems. You don't have to fly hours and hours. So I think basically those 3 are the major reasons why people are scared of having surgery locally.
All right. Thank you so much, sir. That was an insightful one. So the next question here is, are there legal and regulatory frameworks surrounding weight loss surgery in Nigeria?
So it's a tough question to answer. We all know that generally in Nigeria, the compliance with laws is not particularly fantastic. With that being said, not many people are dabbling yet into bariatric surgery because it takes a lot of technical skill and prowess, and not many people, as of today, are dabbling into it. Maybe I might not be aware of those, but at least there are a few people in Nigeria that are doing bariatric surgery. Again, what I tell people is that before you go for a procedure, just try to do some research on your surgeon, do your research on the hospital, check their experiences, check their background before you dabble into this kind of decision, because we all know that weight loss surgery is a life-changing decision, and you don't want to be making that decision putting yourself under the wrong hands. Yes.
Nice one. Thank you, sir. So, the next question here. We have people that, okay, I'm sure that there are people that have actually done gastric sleeve for here at Gesling Bariatrics. So we would love to hear testimonials you have from individuals who have actually done their weight loss surgery here in Nigeria.
Okay. So great. Again, I have to mention something. So weight loss surgery in Nigeria is still relatively at its infancy, and we know Nigerians. Again, this is our country, this is our culture. Many people, or most people, I can say this one without any doubt, that most people who have done weight loss surgeries keep it a secret. Many from their friends, many from their family. Nobody wants to post on Instagram that they had weight loss surgery. So I'm taking this time to shout out to Ezine. Ezine had a gastric sleeve with us, and she's everywhere. You can go to our page, and you definitely will see some of her testimonials. She does videos almost every week now, which is amazing. So there are not many people like Ezine, for example, that will show that they did weight loss surgery and they're getting the benefit. So that being said, we have massive testimonials. The one that usually makes me really, really happy is the confidence, really. So people have been obese maybe all their life. They do weight loss surgery, they drop 20, 30, 40 kilograms. And then you just know the way they walked in when they came for the consultation is totally different from the way they walk in when they come for a follow-up. You see their smile is brighter, you see they're lighter. Other testimonials include, again, treatment of medical conditions. So someone who's been hypertensive on 3 or 4 drugs, on amlodipine, lisinopril, all those things. They lose 20, 30 kgs and then they don't actually need weight loss surgery. They don't need, antihypertensives anymore. They don't need cholesterol drugs anymore. They don't need drugs for their knee pain. And you can just keep going on and on and on and on. So this is not, it's not something that is strange or abstract. Weight loss surgery works, and I pray that more people are more honest and more open to sharing their experiences, and then you know that yes, this is life changing. To be honest, it's life changing.
Thank you so much, sir. So people are already dropping their questions, and the first one I have here is, I did gastric balloon, but the progress is slow for me. So do you have something to tell the person about that?
So that is out of the scope of this discussion, but so it depends on a lot of things. So the gastric balloon, of all the weight loss options, the gastric balloon is a little bit tricky. 80-90% of people would lose a lot of weight. You see that 10-15% can be quite annoying when you have the ballooning, you're doing everything right, but you're not losing weight. So 2 things can be done. One is, depending on your weight, and the type of balloon, you can adjust it. That means that you can increase the volume if you have a sparse balloon, for example, and that will lead to additional weight loss. Or you can try injections with it, it will help. Or worst case scenario, if everything doesn't work, you take the balloon out and come for surgery.
Okay, sir. So compared to other methods of weight loss that we have here in Gesling Bariatrics, how safe will you say gastric sleeve is compared to the remaining weight loss options that we have?
So let me tell you what, of all the options for weight loss, the surgery actually has the highest risk. The injections are safer than the balloon. The balloon is safer than the surgery. But if I want to give you numbers now, in terms of the risk of maybe death or serious complications from surgery, we are talking about 1 in 1,000. So that is still relatively low. So yeah, even though surgery is riskier than many other options, it's still overall very, very low risk.
Thank you, sir. So someone said gastric aftercare is top notch. So can you just talk about the aftercare after a gastric sleeve?
So
Yeah, at Gesling Bariatrics. What is the aftercare like?
I can spend a whole day talking about this. So this is Okwemi's a dietitian, so she should be the one answering it. So I push the question past you. So what is the aftercare after gastric sleeve?
All right. After our gastric sleeve here at Gesling, patients actually stay within 24 to 48 hours, and they can go home to come back after 5 days to see the doctor just to remove the dressings on the site of the wound. Then after your gastric sleeve, obviously you cannot start eating foods you eat normally. There's a dietary progression, and you'll also be given supplements. Fine, a lot of people don't use the supplement, but it's better to play safe. So we start you on clear fluids diet. When we're talking of things that are not thick, then the consistency of water, like your tea, your juices, your broth. Then from clear fluids, and you're going to spend like 2 weeks on clear fluids, just to help your stomach, to get used to the new stomach, because the size and the shape of the stomach is going to change. Then from your clear fluids, you are going to be progressing to the puree stage. From purees, you go to soft diet, then to your regular meals, and we are going to follow you up all the way. And the type of foods you eat will be considered in planning your menu. We are not just going to enforce things you don't know how to eat because you have a gastric sleeve. So the aftercare after gastric sleeve is top notch, because you are going to be having an appointment with the doctor. You don't have to come down here for your appointment. If you are not in Nigeria, we do virtual consultations too, so it's safe, and you are in safe hands basically. All right.
So thank you. Maybe a little addition. Like you rightly said, most people go 1 day, 2 days, they're back home. I see them typically after 4 or 5 days, so that I inspect the wound. If we're sure the wound is fine and they are tolerating very well, our next appointment might be 3 months. Obviously, patients are closer to the dietitian. My own job is just to do the procedure. The dietitian follows them up, so the relationship with the dietitian is much, much closer and cordial than to me, because I see maybe once in 3 months, once in 6 months. And unless something goes wrong, they really do not need to see me. And then thankfully, because of technology now, most of our consultations are virtual. We've had calls in patients in the UK, patients in out of town, in Badon, Lagos, all those things. So yeah, aftercare, we follow you up, and then we make sure that everything goes fine.
All right, thank you, sir. So another question: do you advise I do weight loss surgery before or after birth?
So that question is quite common. It depends really on you. If you're actively trying to conceive, that means that maybe you've got a kid, you need one more kid, and then you want to lose weight. Because after weight loss surgery, we advise people not to get pregnant for 12 to 18 months after the surgery. You can't get pregnant. So if you are actually in a hurry to get pregnant and deliver, we advise you to complete your family and then come for the weight loss surgery. But if you've completed your family and you're happy to have surgery, that's fine. But if you're trying to get pregnant, we advise you to hold on a little bit, complete your family, and then come for surgery. Remember that you can't have surgery while you're actively trying to conceive. If you're pregnant, you can't have surgery. If you're breastfeeding, you can't have surgery. So you need to have completed those before that.
Another one: is it an open surgery or laparoscopic?
So bariatric surgery is keyhole surgery, so it's laparoscopic surgery. It means that we're making tiny holes, and that is why the recovery is fast, because we're not cutting you open like you do, for example, for a CS or fibroid surgery.
So some people are always scared that this thing is permanent, like gastric sleeve is permanent. What do you have to tell this type of people? Because some people are saying, that's why I don't want a gastric sleeve, because it's more permanent.
So yeah, it's understandable. Again, I've had many people come in. He said, I'm here to get married, I'm here to have kids, I can have a gastric sleeve, I'm scared of something. It's okay to have fears. Like I said, gastric sleeve is safe. And then once you realize that obesity is a chronic problem, obesity is not a short-term problem. It's not like malaria, for example, that you use anti-malaria drugs and you're fine. Obesity is long-term. It means that if you keep doing something, you're losing weight. The moment you stop it, you go back to your bad habits, the weight comes back. So usually what is cost effective has to be something long term. So I tell people that obesity is permanent, to be honest. And if you have something that can deal with it over a longer period of time, I think it's worth it. The injections and the balloon, which are the alternative, are short-lived. You take injections, except you have like a big bag of money, you can't take injections for more than 6 months. The highest balloon can stay for 1 year, and then when you look at the cost and effectiveness, they are worlds apart. The surgery is much, much more effective than that.
Okay. Someone asked that, she has done balloon, so would there be a discount if she wants to lose?
So send us a DM, we'll talk about that.
Send a DM about that. So, is gastric sleeve surgery safe for people with GERD, like gastric esophageal reflux diseases?
So there are two answers to that, because you see, reflux disease usually it's as a result of obesity, because you have a lot of organs around the stomach, and then that leads to reflux. So usually when you lose weight with the sleeve, usually that resolves. But again, if one has really, really severe reflux, very severe reflux, you can't do anything, usually we opt for the gastric bypass instead of gastric sleeve. So that is one of the times the gastric bypass is indicated above the gastric sleeve.
Okay. So can you tell us more about gastric sleeve, gastric bypass, and dumping syndrome?
Okay, so dumping syndrome is not seen in gastric sleeve, it's seen in gastric bypass. The reason being that because you're diverting food away from the stomach is actually supposed to hold food and then release it in tiny amounts into the intestine. Once you do a bypass, that mechanism to hold the food is gone, so food can go straight from your mouth into your intestine. And because of the rush of the fluid, it can lead to shifting in water and a lot of hormones and all that. And that can lead to temporary dizziness, fainting spell, abdominal pain, abdominal cramp. So that is one of the side effects of getting a bypass, and you need to be really aware of that before going into that.
Thank you, sir. So if you are just joining us, please do well to drop your questions. We've been talking about the topic, weight loss surgery in Nigeria. Is it really safe? And Dr. Timi has actually spoken, he has given us a brief overview of the type of weight loss surgery we have in Nigeria, which is the gastric sleeve and gastric bypass. He has explained the purpose and potential benefits of weight loss surgery, that it can lead to resolution of various non-communicable diseases like hypertension, diabetes, etc. He has also addressed certain concerns that people have that they are related to weight loss surgery, like anesthesia, like, okay, you don't trust Nigerian doctors, and he has assured us that a lot of people have done weight loss surgery in Nigeria and they are really safe. And the aftercare too is top notch, because you have your family here, the type of food you eat, they are here, and they are really accessible. And when you do your weight loss surgery in Nigeria, it's actually cheaper than you traveling down to Turkey, traveling down to the UK, to the US to get these things done. He has spoken about legal and regulatory framework surrounding weight loss surgery in Nigeria, and he has also shared success stories and testimonials of people that have actually done weight loss surgery here in Nigeria. A big shout out to Ezine again. So thank you. He has also answered some questions about gastric balloon, gastric sleeve, then the injection, that the gastric sleeve is actually the one with the most significant result, especially if you have a BMI greater than 35 kilogram per meter square or 30 kilogram per meter square with other comorbidities. So I'll move to the next question. Can a trying to conceive lady do the balloon or injection method? So I know this is actually out of the topic of discourse, but
yeah, so if you're trying to conceive, yeah, one of the temporary methods is actually perfect. One of them is perfect. Like I explained earlier, that if you're going for surgery, you can't get pregnant for 1 year. Anyone you desire, to be honest, it goes be the injections or the balloon. The balloon may be a little bit faster than injections, but both of them work the same. And the main joy of those temporary things is that once you get pregnant, you can actually stop them. So the moment you have a positive pregnancy test, you can organize for the balloon to be taken out, or you stop injections and then you go on to have
all right. So someone asks, does gastric sleeve affect getting pregnant?
So in a good way, yes, because we know that overweight and obesity reduces fertility, for example. So typically most people, and then this is one thing we tell people, especially females that come for surgery, is that before you come for surgery, we have to be sure that you have a contraceptive in, because fertility rates jump off after surgery. Because what usually holds pregnancy and fertility back sometimes can be the weight. And the moment you have that rapid weight loss in the initial phase, your fertility level shoots up, and many people get pregnant almost immediately. So you need to have contraceptive. So to answer your question, yes, it can affect pregnancy and fertility rates, and it's usually in a good way.
Thank you so much, sir. So if you are just joining us, well, guest name first Instagram live session. Looking forward to having you on our subsequent editions. So this will happen sometime again next month, and we'll still be talking about weight loss surgery. but we'll be having another topic of discuss, but still about weight loss surgery. So remember to like, remember to drop comments on our post, remember to share. This video will be available after this session for you to watch. So if you are just joining us, like I said earlier, the topic of discuss is weight loss surgery in Nigeria. Is it really safe? Yes, it is really safe. Here at Destin Bariatrics, we have people who've actually done weight loss surgery for, and they are fine. No complications, no complaints. Everyone is fine and they are doing well. So another question: how soon can one lose 30 kilograms on gastric sleeve?
So I try to shy away from answering those kind of questions because weight loss is actually very complex. We've seen people lose 15-20 kgs in a month. We've seen people lose 8 kgs in a month. So there is actually no correct answer to that. It depends a lot on your body metabolism, your physical activity, your compliance with the dietitian. But most people lose averagely between 15 and 20 kgs per month after a gastric sleeve. So it's not as if you'll be losing 20 kgs every month. So in the first few months, it's rapid and then it slows down and then you have a plateau. So I honestly cannot answer that question when exactly you lose 30 kgs. But you can just send us a DM, book a consultation, and then we'll have further discussions.
Okay. So some people believe that after a gastric sleeve, that okay, the size of my stomach can reduce. I can just relax. I don't need to work on my food. I don't need to work on exercise. Since my stomach size has reduced, then I'm going to lose weight automatically. Does it work like that?
No, definitely not. At the base of, and this is what I tell people, is at the base of every weight loss procedure intervention is the fact that you need to have that lifestyle modification. So everybody, if you ask around a lot, if you go on YouTube a lot, you find out that many people have done sleeve or bypass or SADI or DS, anyone, and then they've lost weight and then they've regained it back. So it is very possible to regain the weight back. What the sleeve does, what the injections, the balloon, what they do is to try to help you modify your lifestyle. If you go back to bad habits of taking liquid calories, taking junk food, not being physically active, you will lose the weight initially and then it will come back. It will come back. And then something just came to me now. I forgot to mention it, that how do you ensure that you have a safe weight loss procedure? So most of the patients that come scared to my office, many of them have gone through YouTube, they've gone through Google search. And one thing I advise people is that drop the phone, stop searching for bad news, because bad news sell fast. So if someone has done a gastric sleeve or a bypass and they have a complication, they put it on YouTube, they're likely to get 1 million views. If someone has done the same thing, have good results, they're likely to have few views. So it's exaggerated the amount of publicity that many of these complications get. Drop your phone, do your research, and then make sure that you're doing it in a very good center, and then you'll be fine.
All right, thank you so much, sir. I've been having a great time. So with all we've said since, I don't know if there's any point we missed out that you'd just like to tell us before we end this live session.
So weight loss surgery is still native, it's still naive, it's still nascent in our environment. A lot of work needs to be done. We're trying to do a lot of advocacy on our page, trying to put information out there. Again, we encourage people to do their research, and if you have questions, we are really happy to answer them for you. Either you drop them on our DM to reply you, or you come over to our office for a consultation, or you can even do an online consultation. I'm happy to answer questions. You can have a direct line to me, and then we'll have a chat about it. Just to allay your fears and let you know that you can do this.
So after the gastric sleeve surgery, the weight loss, does it last? Like, you just keep losing weight too. So how is the weight loss like?
So like I said earlier, the weight loss usually is marked the first 6 months to 1 year. The weight loss can be really pronounced. After that, it settles and then you have some plateau. So it's not definitely that you keep losing the same amount of weight. If you lost 20 kgs in the first month, doesn't mean you lose 20 kgs the next month. So the body has some regulatory processes that helps keep your weight in and around the normal level. So it doesn't let you keep losing the weight consistently. Your body fights back and then the weight loss slows down a little bit.
Okay. Someone said, what size or amount of the stomach is taken out?
So that's a good question. I've had many. There was a patient that came to me once and told me to take out 50% of their stomach, and I just laughed. You see, the gastric sleeve is a standard operation, and then we take out 80% of the stomach. The problem with doing less or doing more is that it exposes you to either suboptimal weight loss or excessive complication. So if you take too little, the weight loss will be very minimal, and then weight regain occurs very fast. If you take too much, the patient might have persistent vomiting, just a non-pleasurable experience. So the standard operation for the gastric sleeve is to take out 80% of the stomach.
Okay. Does anyone in any age group or age bracket qualify for this surgery, or we have a particular age that someone must have reached before we can carry out the weight loss surgery?
So again, in Nigeria, we still do a lot of adults weight loss surgeries. Yes, weight loss surgeries can be done in adolescents, but most of weight loss surgeries are done in adults.
Thank you, sir. What risks are involved with the procedure, and is it reversible?
So the risk of gastric sleeve, okay, let me answer the reversibility. It is not reversible. So over time, the tiny stomach that is left will stretch a little bit to accommodate more food, but it almost never gets back to the normal size. So in that regard, it is irreversible. The risk of gastric sleeve are, like I said, it's 1 in 1,000. It's rare. The common one in and around surgery include bleeding, infection, blood clots, and for example, for bleeding, we make sure that everywhere is dry before we leave, and then we usually admit patients in HDU after the procedure so that we're able to watch them. For infection, we give antibiotics. For blood clots, we give them stockings and then blood thinners. So we try to be one step ahead. Prevention is better than cure. That's what they say. So we try to prevent it by doing all these things. But all these things may happen, and then we have a discussion with it even before the surgery. It's a possibility.
Okay. So how long is the recovery process after weight loss surgery?
Recovery process, usually, like I said earlier, most patients are discharged the day after surgery. So usually 24 hours after surgery, they're back home. For people to resume their normal work, we tell them wait at least 1 week, and so within 1 week they should be able to resume office duties, catering to self, all those things. Resumption of gymming, high duty activity, will tell people to wait for 4 to 6 weeks.
All right, sir. So someone said, how quickly can I expect to start losing weight?
So weight loss starts almost immediately. Within the first week, you're going to drop a few kgs. First month, you're going to drop at least 10, 15 kgs. So weight loss surgery, the good thing is the weight loss is almost immediate.
Thank you, sir. Someone asked that, is it true that one complication is constipation?
So it's not. We try to answer this too. It's not a complication really, because after the gastric sleeve you actually are not eating. So you need to actually eat to form feces. If you're not eating, you can't pass out feces. So because after the sleeve you're going to be started on liquid diet, you're going to be taking fluids. So there's actually nothing to pass out. But again, in a bit to help with a bit of constipation that may happen, we give people laxative. So it's not a complication in the actual sense. It's just something that is expected.
All right, thank you so much, sir. If you are just joining us, remember to drop your likes, drop your comments, and looking forward to seeing you in our next version. So this video will be saved, so you can watch it if you are just joining us. Thank you so much for joining us. Thank you, Dr. Simi. Looking forward to seeing you again. So watch out on this space for more contents like this on weight loss surgery here in Nigeria. Thank you. Bye.
Bye.